topic is drug interactions of immunotherapy for cancer patients in Canada, and this is really relevant because cancer diagnosis in Canada is extremely high and it is growing. And then these people come to get treated, and most of the time it's chemotherapy, which we know has really detrimental effects, can be really hard on the patient. So bring in immunotherapy, basically this amazing strategy that uses the body's own immune system to fight cancer, which the T cells should actually be doing anyway. So let's talk about why that isn't happening. So basically, on T cells, you have these receptors that, when activated, inhibit the T cell's activity. Now, why might we have these? Basically, you want to protect your own body from the T cells. So your own body is going to activate that receptor to inhibit the T cell so that it doesn't fight your healthy tissues. Thing is, though, cancer is activating those receptors. Cancer cells are inhibiting the T cell so that the cancer can grow and thrive, despite being a target for the immune system. So we bring in ICIs, called immune checkpoint inhibitors, and these are the main immunotherapeutic class of drugs that we're talking about today. Well, what do? They block these receptors. They ensure that the T cell is staying active in fighting cancer, which sounds great, right? The thing is, those receptors were there for a reason, right? We said they were there to protect your own body. So now, if you're blocking that, the T cells might be hyperactive and they might also harm your own cells. You are more likely to develop autoimmune conditions and adverse side effects because of this. Another major issue with this is that the research on ICIs is so novel that its interactions with other medications is not fully understood yet. So what we talked about in our paper is two major types of interactions. Interactions that are going to decrease the efficacy of the ICIs, and then interactions that are going to cause adverse side effects. So the ones that decrease the efficacy, we said, are corticosteroids, PPIs, and antibiotics. PPIs and antibiotics are actually because they alter the gut microbiome, and you actually need a good balance of microflora for ICIs to actually work. And then the ones that cause adverse side effects, we said, are statins, because statins can actually make your muscle cells appear abnormal to T cells. And now ICIs have made those T cells so hyperactive that they might attack your own muscle cells. So talked about the benefits that can be helpful in destroying the cancer cells. It's already been shown to improve progression-free survival, decrease the amount of cancer cells in the body, but then we have these adverse side effects that actually disproportionately affect certain populations. So imagine someone who already has an autoimmune condition. They're going to have worse outcomes. Now, luckily for them, actually, they're often excluded from ICI treatment because this is understood. But take like an older adult with polypharmacy who has multiple medications at once. They are at risk of all these things, right? And the thing is, oftentimes when people come in and are prescribed ICIs, they're not thoroughly evaluated for all the medications that they're taking. So we said there needs to be a thorough understanding of their medications that they're on before being prescribed ICIs. And another thing is that rural populations have less access to this treatment because this treatment is so expensive. So yes, while it's beneficial, it affects certain populations differently. Thank you.